It's not your usual traveling exhibit, that's for sure, but it is an important one. The Colossal Colon, no kidding, is a massive model making the rounds of hospitals and other public places to raise awareness about colon cancer. NJN News health and medical correspondent Sarah Lee Kessler reports.
Hunterdon Medical Center in Flemington is the latest stop for the Colossal Colon, a traveling 40-foot-long roadshow that gives patients, visitors, and staff a bird's-eye view of the inside of the colon, including dangerous abnormal growths that often produce no symptoms at all.
It's really neat to see it firsthand and kind of be the scope and go in, so.
It's a deja vu all over again.
60-year-old Margaret Hastings was diagnosed last year with colon cancer during a colonoscopy she delayed for 3 years.
And I ended up having to have a 6 to 7 inch, I can't remember the exact, I think it was 7-inch section of my colon removed. I wouldn't have had to do that if I had had the follow-up screening at the proper interval.
How serious is colon cancer?
Well, colon cancer is the #2 cause of cancer death in this country, accounting for about 50,000 deaths every year.
Here in New Jersey, there are more than 1,500 deaths. Colon cancer expert Jeffrey Hartford says that's why exhibits like the Colossal Colon are so important.
March is National Colorectal Cancer Awareness Month, so this is all part of our move to try and increase the percentage of people that are getting screened.
A healthy diet centered on whole grains and beans and fruits and vegetables, as opposed to foods loaded with sugar, salt, and trans fats, can also reduce the risk of colon cancer.
We talk about eating the rainbow, and when we're saying the brighter the color, the more vibrant and the more antioxidants that are in those foods.
It's believed that up to 30,000 lives could be saved each year if people had colonoscopies more regularly. But Dr. Hartford says many people put them off either because they're nervous about the procedure itself or about the preparation for it.
If you ask most people, they'll tell you that the prep wasn't any fun, but they'll also tell you it wasn't as terrible as they thought, and it was nowhere near as horrible as everyone told them it was going to be. And the truth is, I've never met anyone who thought it was worse than dying of colon cancer.
You know, Sarah Lee, 7 months after my surgery, I held my first grandchild in my arms, and I knew that if I hadn't had the screening, I might have missed it. So please, anyone who's listening to this, get the screening done.
Sarah Lee Kessler, NJN News, Flemington.